Hello, everybody. This is Missy Berry, and I'm here today to go over your exposure control plan as well as your bloodborne and airborne pathogen training for the year. So let's hop right into it. So we do have an exposure control plan, and it is covered under our policy and procedures IC1 and IC2, and I have linked those here on your training webpage for you to review as well. You need to make sure and read through those as part of your training. So our exposure control plan is updated annually, and the purpose of the plan is to basically identify and protect job roles that are at risk for exposure to bloodborne and airborne pathogens. So we know as our jobs as healthcare workers, whether you're a nurse or whether you're a physical therapist, speech therapist, whichever one, there's always the risk for you to be exposed to either bloodborne or airborne pathogens. So that is what our exposure control plan does. It does break down our job categories based on risk. Now, obviously, just based on the types of employees we have here at Dedicated, nursing generally is going to be at a higher risk because they deal with things like drawing blood, as well as dressing changes. So physical therapy does do dressing changes as well. So you guys are at risk for those bloodborne pathogens as well. So it outlines the safety measures that we are to take whenever we are performing our job functions to decrease our risk. So obviously those are going to be standard precautions first and foremost. So anytime that there's a potential for exposure to blood or airborne pathogens, you are to use the appropriate standard precautions, which would be hand hygiene, gloves, PPE such as gowns, face masks, eye guard for splashes and things like that. And so all that stuff is available to you here at Dedicated. It's in our supply closet, and you are welcome to get it and use it as needed. So that is the first step in that. It also outlines and lays out a plan for what to do if you are exposed. And obviously that is going to be to report it immediately to your supervisor if you're exposed to any kind of bloodborne or airborne pathogen risk. So we talked about what jobs are most likely to be exposed and how already. So the staff responsibilities are that you attend this training, that you understand what the plan is, and you're going to read that when you go over policy and procedure IC1 and IC2 that's attached to your training module. And then you are to adequately protect yourself as you're working. And so the agency's responsibility is that we train you and provide you with the equipment necessary. It is your responsibility to attend the training, learn from the training, and to use the equipment that we provide for you. So like I stated, all PPE is available to you. It's here in our supply closet, and we have plenty. You don't feel like you have to, skimp on that. We have plenty. We can get more, that sort of thing. We want you guys to be safe. So we talked about universal or standard precautions is the other name for that. So we use them all the time, but what exactly are they? And so all of these things go into what we call universal precautions. So engineering controls such as sharps disposal, sheathing of needles, using safety lock devices for our needles. So we want to use certain engineering controls to keep ourselves safe. When we're talking about bloodborne pathogens, we're talking a lot, mostly about needle sticks and needle injuries, but that can be exposure to bloodborne pathogens when you're changing a dressing, those sorts of things. So we want to make sure that we are using the adequate sharps disposal technique. With the staff is all supplied with sharps containers, and those are here in our supply closet as well. We are not recapping needles. We have self-sheathing needles and safety devices on all of our blood draw devices, so we are never, 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 never recapping needles, and that is a huge no-no, so make sure that you are not doing that. We also want to make sure that we are utilizing appropriate workplace practices, such as how we handle specimens. We're always wearing gloves, we're using a clean surface, a barrier at all times. We are changing gloves as needed when they become soiled or damaged. We're changing those. We're utilizing the appropriate PPE, such as goggles, a face mask with a shield on it, a gown, shoe covers whenever there's a potential for a splash from bloodborne pathogens as well. Vaccination against things like hepatitis B and now COVID-19 are obviously some things that we want to use to protect our employees as well. Anytime you have an exposure, you are to report that immediately. So you're to take the adequate precautions. If it's a needle stick, you're going to first do not pass go to the sink or wash your hands with warm water and soap for 1 minute. And then you're to notify your direct supervisor, which is always me, and we're going to start the appropriate prophylaxis and testing for you. So we're going to make sure that if you were exposed, we're going to test who you were exposed from, and we'll test you as well for a certain number of months. So we have to do some post-exposure follow-up if you were ever exposed to either a splash that went into like your mouth or your eyes or your nose, or if you had a needle stick. We also want to make sure that we are labeling and doing the appropriate hazard communication. So sharps containers are labeled. Your hard container that you transport blood in should be labeled. You should be using your blood cooler to transport lab supplies. You should be using biohazard bags for things that contain biohazardous material. Okay, this is a handout I know that's kind of hard to see. So this is talking specifically about airborne pathogens. And so you guys can read over this whenever you do the handout section, which is the section after this video in your training module. Basically, it says airborne pathogens differ from bloodborne pathogens in that they are spread by inhaling a microorganism. When an infected person coughs or sneezes, tiny droplets spread out into the air and they can remain airborne for several hours. There are 3 types of airborne pathogens, which are viral, bacterial, and fungal. Meningitis, the flu, pneumonia, TB, COVID-19 is obviously the hot button when we're talking about now, and SARS are all examples of airborne pathogens. Healthcare workers that are providing care for patients that have respiratory illnesses face a greater risk than the general public of contracting these diseases. So OSHA does require that all healthcare personnel be issued PPE. So anybody that has active TB or active COVID-19 does have to use an N95 respirator, and so we have those here. So we're never going into homes where there is suspected COVID or confirmed COVID, or we don't take care of TB patients, but if for some reason there was a suspicion of TB, we would always use an N95 mask. The likelihood of you contracting TB, if you're exposed to it, depends on a lot of factors. How strong the strain is, how long were you exposed without a mask, those sorts of things. Symptoms of TB are going to be weight loss, cough, fever, chills, chest pain, night sweats, hemoptysis, which is coughing up bloody sputum, and generalized weakness. We do require that you be tested for TB exposure prior to employment here, and then you annually fill out a form assessing your risk based on symptoms. SARS, or another word for that is acute respiratory syndrome, is a viral illness that's caused by the coronavirus. There's more than one coronavirus. There's thousands of them. The one that we all know and love right now is COVID-19. We're obviously in the middle of a pandemic. So this virus is spread when a person coughs or sneezes in close proximity to others. Now, we're going to touch a little bit on COVID-19 in this training, obviously, because that's what we're all dealing with currently, but there's a whole other module about COVID-19, so we're going to save the bulk of that training for that module. Symptoms of SARS includes high fevers, headaches, body aches, and 20% of these patients do develop diarrhea. Most patients do, however, have a dry cough and develop pneumonia, which is what is the life-threatening part of SARS. H5N1, which is bird flu, is still out there in the world today, and so I've given you some information about symptoms about that. There is no treatment for H5N1 flu, and so it just has to run its course. It can be fatal, though, if contracted, so want to make sure that we are protecting ourselves with an N95 if you have any suspicion of avian flu. Our best defense against air pathogens is good respiratory etiquette. So teach patients to cough or sneeze into the crook of their arm or use a tissue, and for everyone to use good hand washing. And so the main thing is if your patient does have a respiratory illness, even if it's the flu or the common cold, there is nothing wrong with having them put on a mask and you put on a mask to do those visits. So we want to make sure and protect you guys to the best of our ability. Okay, and then I've also given you a handout here about occupational HIV transmission and prevention among healthcare workers. Your best prevention against that is just to assume that everyone you come into contact with has HIV. And so you're going to use those standard precautions. That's what's appropriate now for HIV transmission risk, is that we just use universal precautions. So we're wearing gloves, we're using those engineered needle controls when we can, all that stuff we went over in those first 2 slides. Okay, and then we did talk about COVID-19. So in the past year and a half, this has been the #1 threat to healthcare workers from an airborne spread illness. We also have to protect our patients from COVID-19. And so I have linked here the website training module for our COVID-19 training for dedicated. So that's it for today. This one's short and sweet. So if you have any questions, you can obviously Contact me here at the office, 936-465-9181, or on my cell, 936-414-5888. Make sure that you do review all of the handouts associated with this training. It is the airborne pathogen handout, as well as the policies and the HIV transmission handout. So make sure you do that next. But the most important part is that you go in and sign the sign-in sheet, which is number 3 on your training module at the bottom. Click that link, go in, sign the training sign-in sheet so you get credit for it. So thank you guys for your time and have a great day.